here on this Thursday edition of the Oakland County Megacast. I'm Ronnie Dahl here in the studio again, Tyler.
Oh,
I know
yes.
You missed me yesterday.
Of course. Of course.
But I'm like, all my stuff is moved around. I'm like, okay, that's good. We'll make it work. You know how, like, you really become ingrained in habits?
Yes.
So when you start a day or you start a morning, you have a habit and you build that habit. And when something is out of ordinary, you're like, ugh. Or is that just for old people?
No, I find the same thing. It's all about keeping the habits and the routines of your day. And when something gets thrown off, it can throw off everything else. It's a domino effect.
I know. Look at that. Just like that, though. But happy Thursday, everyone. Great to have you with us here on the Oakland County Megacast. Just a little bit chillier outside, but I will say the sun is shining.
It is.
Still a beautiful fall day here in the state of Michigan. Keep in mind, if you are waking up a little bit grumpy today because it is about, 20 to 30 degrees cooler than it was a couple days ago. Remember, this time last year, we were getting a crazy snowstorm, and we were under like 8 inches of snow.
Yeah.
Be grateful.
Right.
I will take the cooler temperatures over the 8 inches of snow here in the middle of November any day.
Yeah, no, so a year ago we had a foot of snow on the ground, and it was freezing cold every single day of the month here in November, or it felt like it was at least. And now, this year it's been nice and warm. It's been sunny. It's still decent outside today, and the only drawback is we're in a global pandemic. Yeah.
Sometimes when you get those Facebook memories that pop up, like, here's where you were a year ago. So a year ago,
take me back.
I was actually, I had a snapshot of my husband and my dog and I, because for our anniversary, it was a kind of a delayed anniversary gift, booked us a hotel downtown at Shinola Hotel.
Nice.
It's a beautiful venue if you've never been down there. But also, like, I worked downtown last year at this time, but it was still different working there and going downtown. And for my husband, he would go downtown for the games here, there, and whatever, but you never really experience downtown. So Shinola allows for you to bring your pets. Oh. And so we had our 15-year-old Cocker Spaniel, and we packed her up and we took her down. I don't think I'd do that with Trixie right now, because while they allow pets, I don't think they would allow this moose of a dog. But we went down, and but we drove down, and it was this crazy snowstorm. It was just insane to be downtown during a snowstorm, but there we were with our little Cocker Spaniel at the Shinola. We, ordered her doggy treats off the menu. Nice. But it's a great, I will say, for people, because we become, when we're talking about habits, Tyler, we do become accustomed to our routines, and that also comes with where we live and how we live. So if you want to shake your life up, or just, Detroit's in our backyard, or, maybe Saugatuck or wherever, take a driving adventure, but spend the night in a hotel and experience a city that you think you know very well, but take the time to experience it on foot. And you'll see it completely different. And so it was fun. I remember it was fun. We walked our dog all through downtown, and took her out for doggy treats, and got her a new sweater from Moose Jaw, this, that, and the other, which of course is going to be donated because it won't fit our new dog. But still, great memories, though. Have you ever done that?
Yeah, taking a trip down memory lane with social media pictures and that. Oh yeah, I do it all the time.
Yeah, but no, I mean, like, you're still so young. Tyler, though, lives Civic Center TV.
Yeah, and I live here. I pretty much do.
You've got to stop that. Like, you need to take time. Like, when's the last time you took time to do, like, a road trip? Maybe to Port Huron.
Oh, it's been a while. I can't even remember it, so it's probably been way too long.
Oh, my goodness. And Tyler, you're like a media guy.
Yeah.
For me, I like to do those and just see different cities and walk those different little cities, but also I take a lot of pictures. So I'll, bring my camera along and do some pictures or things of that nature, and it just kind of shakes up where you live.
It's probably been a couple of years, honestly, actually, now that I think about it. Probably last time wasn't in Michigan. It was in Arizona visiting some family. It was a couple of years ago in late June, early July, out there in a few different places. A few days in Phoenix with some family, and we traveled up to Sedona and up to the Grand Canyon and back through Sedona again, and that was really nice.
Wasn't it? So my sister lives in Phoenix as well. I went out there last March. All of my sisters, we had a sister group. So there were like 5 of us. So we went out there for a sister reunion to visit my sister in Phoenix. I had never been. So it was right before the shutdown, like 2 weeks before the shutdown. I had never been, and I had never been to Sedona. And did you go, and did you see the Snoopy?
Yes, I did, yeah. Oh, yeah, Snoopy, yep, that's a big one. My favorite hiking spot on the Sedona Red Rocks is actually this place called The Saddle, which is, it's a bit of a hike, and it's a little bit treacherous near the end of it, but the views there are arguably the best I've ever seen anywhere I've been, other than of course the Grand Canyon. When I was out there, and especially near the end of the day, it was the sun starting to set, and you're just looking out across the canyon. That was breathtaking. But Sedona's really close second.
Don't you have we wake up and we take the world for granted?
Oh yes.
But when you see sights like that, you're like, wow, where did this come from, and how did our world get created that we have these incredible natural wonders right here in our backyards? And so if you just sometimes take a little trip, see the world and through different eyes, and even if that little trip is just through the West Bloomfield Parks Division,
right.
Take a ride or walk down the trail and see things differently as well. But it is a beautiful day, a little bit chillier, but still a beautiful day. And the good thing is we don't have a snowstorm like we did last year. So get out and enjoy that. But still, in the middle of all of this, you know why I like to go on the trail, Tyler? Because I can go out and walk the dog, and I pretend like the world is normal. Do you do that?
Yeah, I do that all the time. When I have some time over the weekends, I'll go to one of many local nature trails or wooded areas out by me out in Wixom, or out this way in the West Bloomfield area, and just try to soak in some sort of normalcy and just pretend I'm not in the middle of the pandemic hellscape that we're currently living in.
Right. My husband enjoys it because one thing I'm not doing is I don't spend money anymore because I don't enjoy going shopping. I hate going to the stores. I don't even like getting gas. I don't like going to Kroger. I don't like going to the grocery store because people just look sad between their masks. But when I'm out on the trail with my dog, because you have to walk her,
right,
the trail's in our backyard, then I could pretend like life's normal, and it's great. So with that, though, life is not normal. And one thing I so desperately miss, live music and going to concerts. Yeah. And I don't know if you saw this headline that kind of came across over the news feeds overnight. And Ticketmaster, how far are you willing to go to be able to attend a concert now? Well, in preparation for a COVID-19 vaccine, Ticketmaster is working on a plan to safely allow people to return to concerts in 2021 by verifying they tested negative for COVID-19 or have been vaccinated. While the plan is still in the development phase, the company told Billboard customers will be required to provide proof of vaccination or a negative test result about 24 to 72 hours, depending on local government requirements, before a concert. Customers would then authorize vaccine distribution providers to send their results to a health pass company such as Clear, which you can use if you sign up and pay a fee, like at the airports right now. If the test result is negative, the lab will notify Ticketmaster, who then will grant the customer access to their tickets. If they test positive or haven't shown proof of vaccination, they won't be allowed to attend the event. I have so many mixed feelings on this. Number one, tests are not 100% accurate, especially for people who get tested early in their exposure. It's going to come back negative. So you're still going to have people at the event that could be positive,
right,
spreading COVID-19. And on top of that, when it comes to the vaccine is still not 100%. So I have so many mixed results on this. I feel like one side of me wants to say, I understand, and this is what we need to do. But the other side says, we live in a free society. And I feel like it's kind of a slippery slope that we're going down, because now is it going to be, in order to do a job, you have to provide this. What happened to HIPAA laws? It seems like all the HIPAA laws. Now, by the way, if you're a reporter and you're trying to get any other information, they're going to slam HIPAA on you all day, update, all night long. But in this case, you're allowed to expose who has COVID.
Yeah, I mean, in this case, people are voluntarily giving their information to and the results to these companies in order to be able to purchase tickets and voluntarily pay to attend these events. So in some capacity, I can understand why that is okay. But at the same time, I think that it is it does have merits as being a bit of a slippery slope to what else are we going to have requiring us to have a negative test, or requiring us to be vaccinated within a certain period of time in order to do down the line if companies continue to take these particular precautions that are extreme precautions, which in some cases are necessary during a pandemic like this, especially with surging numbers once again. But I can see merits in both sides of that argument.
But we're in a pandemic, and once you're in a pandemic, when does the pandemic end, and who determines when the pandemic ends? Because there were, if you go back and you read the history of the Spanish flu, and one of the things is this was a kind of a form of discrimination, and granted, it's a totally different world right now with testing as well. But if you could show that you did not have the Spanish flu, then you were allowed to get certain jobs. So some people were feeling like it was a form of a discrimination as well. And how much and how willing of our privacy are we willing to cross these lines? And should we have to? And the other issue comes up, I miss live concerts, but is my personal privacy? Because at the end of the day, we respect that they're saying that they will protect this information. At the end of the day, it's all cyber related. They can't 100%. I mean, we've had banks that have been banks that have been violated by hackers. We have countless other organizations that have done the same thing. And so when you go to a health agency, you're giving all your information. Your name, your date of birth, your social security number, your weight, all your personal information, because it's supposed to be protected. Right. But now this kind of opens that up. So it's going to be a good conversation going forward, I think.
Yeah, it will be. And the question of who determines when a pandemic is over is a valid question that needs to be determined, and that government at multiple levels I would hope are working on right now, as we're getting closer, it seems, to a vaccine.
Yeah.
Probably not.
I will say I don't know if how much faith I actually put in our government.
Not much.
Right, exactly. Also making headlines in CivicCenterTV.com as Metro Detroit County official departments are among those in Michigan readying on how to store COVID-19 vaccines once they become available. Here in Oakland County, the officials have ordered 10 refrigerator storage units at $13,592 each using Federal CARES Act funds, which is, again, tax dollars. The refrigerators are capable of storing vaccine at ultra-cold temperatures necessary to preserve the 2-dose vaccines, which Pfizer Pharmaceutical Company says need to be kept at minus 112 degrees Fahrenheit. Pfizer has designed temperature-controlled thermal shippers that use dry ice to maintain recommended storage conditions for up to 10 days. On Monday, keep in mind the pharmaceutical company said initial testing showed its vaccine might be 90% effective at preventing COVID-19. Pfizer expects to produce up to 50 million vaccine doses by the end of this year, up to 1.3 billion doses in 2021. Keep in mind those first initial doses are going to go to those on the front lines, as it should be. And so for regular people like you and I, Tyler, we're on the way back in.
Oh, yeah.
We're looking at March or April.
Yeah, it's going to go to the people that it absolutely needs to go to the most first. Those that are fighting this on the front line so that they can treat people that continue to come in and will continue to come in for COVID-19 into the hospital systems and other medical systems. It'll go to people that are in high-risk categories for COVID-19, people with comorbidities, people who are in elderly populations that have been so vulnerable to this, especially in Michigan. Those in the nursing home communities are likely to be higher up on the list than regular people like you and I, regular healthy people like you and I, that frankly can wait a little bit longer and continue to do all the other things that we've been doing for 8 months now, with the social distancing, mask wearing, hand washing, vigorous hand washing, and so on.
We're running a little bit behind schedule because of my rant, but let's move on here. And I know that the local hospital officials were holding a press conference just a short time ago to talk about this issue as well. But with the coronavirus raging in Western Michigan, the CEO of Spectrum Health said its hospitals are nearing capacity as a number of people hospitalized with the virus has tripled just in the last 20 days, and it impacts all age groups. Spectrum, which operates 14 hospitals in southwestern Western Michigan and employs 31,000 people, announced Wednesday it's canceling non-emergency inpatient medical procedures, moving to virtual healthcare visits as much as possible, and limiting visitors to its hospitals. It's also expanding its intensive care unit capacity, adding beds. Keep in mind, too, for all the regular people out there, if you need to get a COVID-19 test because of a shortage of testing supplies, Spectrum Health on the western part of the state is also limiting who can get a coronavirus test, prioritizing people who have had symptoms. And I know you recently went for a test and you kind of experienced that, not so much that we can get the test right now, but it's the response that is going to be delayed.
Yeah, initially when I had made the appointment to get that test, out of an abundance of caution, just because I'm around people, again, for those that are tuning in today and haven't listened throughout the week when I've said this story, is the reason I am is because I helped my dad out, and he is immunocompromised because he has MS, and he gets infusions to treat that wipe out his immune system twice a year. And so, out of an abundance of caution, because I'll be helping him more often over the next few weeks and helping some other people more often over the next few weeks, it was best for me to just make sure that I wasn't coronavirus positive and potentially passing that on to him. So when I went to go get the test at a local urgent care facility, they had said that usually their tests are about 3 to 5 days for response, but it could be as long as 3 to 5 or 3 to 8 or 3 to 10 days right now because of the surge in cases, and there's some prioritization of which ones which tests they are running first, those with symptoms, those who have known exposures, and instead of those who are getting voluntary tests, such as I.
You know, it's such a hard world that we're living in right now. And I know that this, the Oakland County Megacast actually started out of the beginning stages of this COVID-19 crisis, never anticipating that we would be 7+ months into it and we'd still be talking about it, but it's almost like we're moving back. Yep. To phase 1, and that's why we are continuing this conversation as well as this show. So you'll find all that information and more if you just head over to civiccentertv.com, click on coronavirus, and at the top you'll find the latest headlines as well as links to the local resources that you need to check as well, because I like to do that myself. State of Michigan, Oakland County. You can put in your zip code under the Oakland County's website, and you can see how many recent outbreaks or cases are happening right there locally in your community. And continuing the conversation, we still have a lot to get to as we kick off the Thursday edition of the Oakland County Megacast. We're going to take a quick break, but when we come back, we're going to continue the conversation, Tyler, about the need that we are seeing with the surge of the coronavirus cases here in the state of Michigan. We'll be speaking with the chairman and medical director and the ER Trauma Center at Beaumont Hospital. Also works at the Lakes Urgent Care, because they are seeing so many people trying to get in to get a COVID test. So we'll be speaking with him and continuing that conversation along with so many other important newsmakers here in Oakland County. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Thursday edition of the Oakland County Megacast. As a reminder, you can catch us right here in the studios Monday through Friday, 10 a.m. to noon on CivicCenterTV.com, as well as the Birmingham Municipal Access Channel. If you still subscribe to TV, we want to say thank you, because a part of your cable bill, believe it or not, does go to support programming such as this. So if you're on Channel 15 on Comcast, that's where you can catch us. Channel 899 on AT&T. If you're out driving around, 89.3 WBLD Lakes FM, 88.1 WBFH over there in Bloomfield Hills. We also want to say thank you so much to the West Bloomfield School District for allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page, and we will be speaking with the principal of one of the high schools a little bit later here and the Oakland County Megacast. But if we can, let's just go ahead and kick off the show with our first guest, piggybacking on the conversation, the important conversation we were just having about the increase of the cases here in the state of Michigan. It does appear we are in the second surge that we had been warned about so many weeks ago, and now it is actually happening. Joining us right now on the Oakland County Megacast is Dr. Sanford Vieder. He is the chairman and medical director at the ER Trauma Center for Beaumont Hospital, and the medical director for the Lakes Urgent Care. We appreciate your time with us here on the Oakland County Megacast. We know your time is important, so let's dive into the topic. Boy, you must be crazy busy right now.
Yeah, that's an understatement. We are very, very busy right now. Virtually every aspect of my life is crazy busy, and it's because of the pandemic, for sure.
So I'd like to kind of start off a conversation in thinking about, you're an individual, you're a doctor, but you're also, a member of our community. And when you see people out without wearing a mask, not taking this seriously, how does it impact you? What do you want the regular person to know in our community about COVID-19? 7 months in, some people just don't believe it's real.
Well, if anybody needs any proof, I'd be happy to have them share some time with me in the hospital or in the urgent care. But it's frustrating because there are simple things that we can all do to really help each other. And it's really what it comes down to, is it's a matter of not only helping yourself and your own family members, but also taking care of other people around you, your friends, your family. And the simple act of wearing a mask and just practicing good hand hygiene can do so much to just reduce the risk. It's not going to eliminate it 100%, but significantly reduce the risk of transmission and spread. And that's really what we're talking about. And I think, unfortunately, what I'm experiencing is that in the community, there's been sort of, we've let our guard down. And I even see this with healthcare workers, because they do great when they're in the hospital, they do great when they're in the office, and then they get home and they're tired of wearing a mask and they're tired of being careful. And the vast majority of healthcare workers that get ill don't get ill at work. They typically get ill out in the community because either they've let their guard down or others around them are being inconsiderate and not wearing a mask. So keep that in mind, because at the end of the day, once we all go down, who's going to take care of the sick?
Yeah. And, talking about that, I saw an interview on one of the local TV stations, and I won't say which one because I don't want to call out the individual that may have been interviewed, but it was someone who was working the polls, and they had an N95 mask on. It was so dirty. The outside was dirty. And I was like, number one, I will tell you, if I was a reporter, I would have said, hey, I'm sorry, but let me give you a new mask, because I would always keep extra mask with me. But it's just another one of those little things where you're seeing people are putting a mask on, but it's not sanitized and it's not clean. So how good in those situations does a mask actually do?
Well, surface dirt probably doesn't really impact the effectiveness of the mask. The one thing that will affect the effectiveness of the mask is moisture. So after some time, if the mask gets wet or gets sweaty, it can break down the fibers in the mask. But I would still rather see somebody have a dirty mask on than no mask at all. At least there's some barrier there. The other thing is that if you're going to wear a mask, wear it properly. It shouldn't be only around your chin or, not covering your nose or your mouth, because that's really the transmission point. So it's important to not only wear a mask, but understand how to wear it properly. Fortunately, in terms of mask supplies in the community and really across the nation right now, we are in much better shape than we were back in April. But that is a reason why everybody should be wearing one, and make sure that they've had an opportunity to try different types to see which fit better than others. I know that I have. Some fit me well, some don't. And it's important to understand which ones do and make that investment into wearing a proper mask.
So knowing that, because we do see people doing all the things that you just talked about, maybe wearing it around their chin or not sanitizing in between this, that, and the other. But as you just said, when we're talking about that, we're seeing this crazy surge in cases right now. The good thing is people aren't dying at the rate that they were in the beginning of this pandemic, and I think a lot of that just has to do with knowledge and education. It was a new virus, and now we know different ways to treat it. But going into the winter months with this crazy surge right now, what do you want the public to know? And can we stop it? Can we stop it without a shutdown?
I think it'll be difficult to stop it without a shutdown, unfortunately. I've often had a theory that if we could literally stop everything for 3 weeks, and I mean virtually everything other than emergency care, we would probably do a significant benefit to the community by getting rid of the virus in that fashion. Now, that's a really difficult thing to do, and I kind of heard some of the comments before. We don't live in a police state, and it's very difficult to get everybody to cooperate in a circumstance like that. In the interim, the reality of it is that you really want to mitigate and minimize the amount that you're going out and doing things right now. It's in everybody's best interest to do that. And one of the things that I really like to just kind of get the message across is virtually every urgent care and virtually every emergency department in the city now is incredibly busy. But a lot of it has to do with the worried well who want to get tested. Really need to try and reduce that as well, because we're now overwhelming again our reference laboratories, and that's why we're seeing 5 to 8 to sometimes 10 or 12 days turnaround for results. We do not have unlimited supplies for rapid testing. We do have some available, but it is definitely still limited. And it's important that if you're not symptomatic, the best thing you can do is stay home, reduce the amount of interaction that you're doing. There's really not a need to get tested if you're just curious, do I have it or not? You should have good reason and good logic behind why you're going to be tested. I'm beginning to have some symptoms I need to know, or I'm having some trouble breathing, or as previously I heard, you're taking care of a loved one who's immunocompromised and you want to be safe. Those are really valid reasons to get tested. Getting tested just because I'm curious, do I have it or not? And then taking the approach that, well, my test was negative, so I'm good. I can go do whatever I want to do. I'm safe. That is really the wrong message. We got to be very, very careful about that as well.
Oh, I love having you on the show right now, especially following our conversation, because, 7+ months into this, and we've had this conversation consistently on the show, but it changes. It changes day to day and week to week. So it's great to have you on with us, because you got to keep in mind, too, there are some jobs where people work directly with the community, and if they had a loved one that was exposed, they feel like they need to go ahead and stay home, then their employer is saying, no, you need to give me a test. And it's like, wait a minute, no, I was exposed and this person was positive. And so this is a great conversation to have. And as we go into these winter months, I guess 2 parts, like, some people, we're just not surprised we're here because we reopened schools. We've reopened colleges. People are going out and about, but even as if we go out and about and we're following the mask guidelines, are we still going to have an increase? And because if we shut down again, it's going to flatten the curve. But once we start to reopen again, won't it just spike again until we have a vaccine?
Most likely. How that spike will go up is hard to determine. Nobody has a crystal ball, but that certainly could happen, and it may happen. There's no question that the vaccine will be yet another tool in our toolbox to help fight this pandemic, but it isn't the panacea that perhaps some people are thinking as well. The other thing about testing that people really don't understand is that, number one, if I had a high risk exposure today, I should not run out to an urgent care and get tested today. You want a minimum of 5 days since your exposure to test, because otherwise you likely have a potential false negative test. The other thing that's very frustrating is that employers requiring a negative test before returning to work. Most institutions now have policies in place with science behind it that you do not need to have a negative test to return to work. What you should do is be asymptomatic at least 10 days out from a positive test. And we are not testing anybody who's had a positive test in the previous 90 days, because even 70 days out from a previous positive, when you were sick, you're likely to still test positive because of the way that the test runs. It still picks up viral particles. And so it really is a misnomer to require employees or somebody else to have a negative test before they can be reintroduced into the workplace or into the family bubble. That is not correct information. And so there's a lot of misinformation. You definitely want to make sure that you're talking with your primary care physician and understand the mechanics behind the testing. What does it mean? Just because I have a negative test, what does that mean? Does that mean I'm okay? If I've had a positive test, do I need to be tested again? Most likely you do not. And because we don't have unlimited testing capacity, we are going to refuse individuals an additional test if they've tested positive in the previous 90 days.
I think it's so great to have you on the show right now, because you're clarifying so many questions so many people have, because in the midst of this surge, just going to the urgent care, I have nieces and nephews that are home from college, and they want to get negative before they go back to college, and this, that, and the other. And it's a nightmare right now to get tested, but people are getting a rapid test, which is different than, a week later they'll get their other test, and it's a different reading. So it's great to have you on with us to help clarify this, but also for us to share this information with people, to have honest conversations with their employers that are maybe saying no. Number one, people who are trying to be cautious that were exposed, saying, I'm going to take time off of work because I was exposed, and then not taking a test because they didn't have symptoms, and saying, you know what, we need to save those tests. We don't want to bog down the system. So it's great to have you on to just kind of clarify this entire crazy world right now that we're going through. And with that, what do you think the outcome is in the next 30 days? Is this going to get back to where we were all the way back in March and April?
Well, we certainly hope not, but unfortunately, a lot of the indicators are that we are going to get there. I can only speak from my own personal experience over the last several weeks. We are seeing a significant increased volume of positivity. And the one good piece of good news is that it does not seem to be as severe as it was back in April. In other words, we are currently not seeing the high number of respiratory failures and patients ending up on ventilators or perhaps even unfortunately passing away. It doesn't mean that that can't happen, and we don't really understand why. Has the virus mutated? Or something has happened. There's a little bit of a difference right now than what we were seeing before. Is it some of the public health measures that have helped to reduce the severity of illness? Perhaps. It's really difficult to figure that out. But I don't want people to sort of say, oh, okay, well, I might get it, but it's not as severe. That is true right now, and we hope it will continue in that fashion. But again, that is not reason or logic to reduce your level of, surveillance and being cautious and still taking all the necessary reasonable precautions that you can to avoid getting the infection or spreading the infection to others who might not be as fortunate and may unfortunately have a bad outcome because of the infection.
Dr. Sanford Vieder joining us on the Oakland County Megacast. Dr. Vieder, we touched a little bit earlier, you touched a little bit earlier on people going into urgent cares and into other providers to get tested. While we're seeing, especially on the west side of the state and even to some extent at some medical facilities that are preparing for similar events on this side of the state, as their facilities are starting to fill up again with COVID-19 cases to some extent, and people are going to the emergency room or they're going to an urgent care for care, what should they be considering before they go? Of course, if they're in an emergency situation and they need to be treated, they should obviously go and get treated. But otherwise, if they're going in for something that's maybe not an immediate need, or they're considering getting a test or whatever the case may be, what should they be considering before they go to these facilities to A, keep themselves and others safe, but also to make sure that they're going there in a prudent manner and not going there just because?
Yeah, great question, and I'm glad that you asked it, because it definitely needs to be talked about. First of all, if you're having chest pain, if you're having stroke symptoms, if you are having severe abdominal pain, all of those kinds of emergent issues, you absolutely should not hesitate to go to the emergency department or to call 911. That is appropriate, and you should do it. It may save your life. I want to be very, very clear about that. The second thing is that, again, if you are not having any symptoms at all and you're curious, I would advise those individuals to not go and get tested. You are contributing to the problem. You're going to bog down the laboratory systems, which are already stretched to the max, and the benefits that you're going to receive from that testing are going to be minimal. Now, where's that in between? And there is an in between. Here are some clear indications for why you should seek care. I have a fever. I'm having trouble breathing. That is an absolute indicator. And I would love to see everybody, and unfortunately I don't have one with me right now, or I would show it on the cast here. You can purchase what's called a Fingertip pulse oximeter. Probably $25 to $35. Buy it at Amazon, Target, one of the local drugstores. Supplies, I think, are still really good. Back in April, it was difficult to find them. This is a device that you can put on your finger, and it gives you the percentage of oxygen in your blood system. It's a very, very simple device to use. Anybody can use it. And what I tell patients is watch that number. And if you approach 94% or less, that is an absolute indicator that you need to seek professional medical care. It doesn't mean that you're necessarily in trouble, but we like to see patients who are seeing that drop in their pulse oximetry, the percentage of oxygenation in their blood. That is a really good tool to use at home to decide, should I go in and get treatment or shouldn't I? You got to remember that the vast majority of COVID positive infections are treated with supportive care. What does that mean? It means controlling your fever, making sure you're getting adequate fluids, okay? Minimizing the opportunities to spread that infection to others around you. And if you begin to have any difficulty in breathing, that is a very, very valid reason that you should seek medical evaluation and care. Okay.
Doc, it's so great having you on here with this perspective. Quickly, because I know we're taking up so much of your time, but if I can just ask you for clarification, because we're seeing where so many colleges right now are requiring students to get a COVID-19 negative test before they leave their college campus and come home for the Thanksgiving holiday. Your thoughts on that?
Well, that's just my personal opinion, and I think that, if they're asymptomatic, they really don't require a test unless they've been positively exposed. If they have a positive test, what are they going to do? Are they not going to be able to go home? That's a conversation that needs to happen with parents and family, and decide how to best handle that in conjunction with their healthcare provider. Requiring a negative test, especially in those individuals who have previously tested positive, they could continue testing for months and not come up as a negative test. Then what do they do? Again, you can't look at this stuff in a vacuum. you've got to use it in conjunction with what is the history, what does the physical exam say, what is the epidemiologic risk factors associated with that potential positive exposure or positive test or negative test for that matter. And it can't be just a mandate, in my opinion, that you have to have a negative test and therefore you go home. You can have a negative test that's a false negative. And so are we creating a false sense of security? Again, it has to be interpreted in conjunction with why are they being tested? Were they exposed? Do they have a roommate that was a confirmed positive exposure by PCR testing? That's a lot different than 3 roommates who are also negative by an antigen test, a rapid antigen test, which is not 100% sensitive.
See, this is why we have different people on the show here on the Oakland County Megacast, because we're able to get a long, in-depth conversation on these very important topics with people such as yourself, because you know so much more than we do. And knowing that, we want to say thank you for your time and thank you for your insight. You have offered a very important conversation for us all to have as we go in to the next few weeks and the next few months, because we're talking about testing and we're talking about hospitals and capacity, but having your perspective has been enlightening. So we so appreciate your time. And quickly, before we let you go, anything we didn't ask that you want people to know before we let you go?
No, I would just say this, everybody, wear a mask, wash your hands, stay safe, and create that bubble of immediate family and stay with them right now as much as you possibly can. I know the holidays are upon us and everybody's thinking about, how are we going to celebrate Thanksgiving and Christmas and New Year's? And, unfortunately, there will be many more in the future. You need to celebrate either remotely like this on Zoom or with your immediate bubble, your immediate family, and stay safe. So I wish everybody happy holiday season and stay healthy.
Doctor, we extend our well wishes to you and your staff there as well. Stay safe, stay healthy, but also thank you for all that you're doing for our community, not just in the middle of this crazy pandemic, but each and every day as well. It is greatly appreciated. So thank you so much. We're going to take a quick break here on the Oakland County Megacast. We're running a little bit late, but it's so great.
Such good information.
It really is.
It's so important right now.
So I tried to go into these conversations and thinking I'm just a regular person, because Tyler, we've had this conversation before, but every day, every week, every month, it changes because the information changes, and that's why it's important for us to continue to be on the air and to continue to bring these conversations.
Yeah, the simple principles remain in place. The hand washing, the social distance, the wearing the mask, keeping your precautions, keep yourself safe so you're keeping others safe. That all stays the same, but the circumstances in which we're dealing with that and the severity of which those decisions can protect other people around you and keep our communities safe changes over time. And with what we're experiencing right now, it's important to get updated information on the context of why all of that is so important.
Exactly. And one of the things out of this conversation is you have to remember we have thousands and thousands of people that are working on the front lines. And so if you go to your employer and you say, I've been exposed, I need to isolate. And they're like, no, I need a test. Well, you got to remember now, number one, should we be taking up a test?
Right.
From someone who, but it's also, there's a time delay here as well. And so those are important conversations for us to continue to have. And so it's great to have someone such as the good doc on with us to expand on that knowledge. We're going to take a quick break here on the Oakland County Megacast. We're running a little bit behind, so we want to say our apologies to our next guest, Jim Nash, coming up on the Oakland County Megacast. He's the Oakland County Water Resource Commissioner. We'll be right back.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Great to have you tuning in to the Tuesday edition of the Oakland County Megacast. I'm Ronnie Dahl, here in the studios alongside the one, the only Mr. Tyler Keefe. Always great to have you. Tyler is such a vital component here to the Oakland County Megacast, making sure we get on each and every day, but not only this show, but also all of the public access shows as well. All the public meetings that maybe you can't attend right now, but you can check in on. Tyler makes all of that happen, so he's a very key member of the Civic Center TV team. So we want to say thank you to him. We're excited to have with us Jim Nash joining us here on the Oakland County Megacast. He's the Oakland County Water Resource Commissioner, recently reelected. I know we had you on just not long ago for our reelection special, but other than that, can we talk a little bit about how this pandemic is impacting what you're doing and how your team is actually operating right now?
Well, we have very set in stone methods now. We have not had a case for some time now. We had a couple early on, but actually they were their spouses were medical professionals, so they ended up getting it through that, and it did not spread through my facility. So we're being very, very careful. We used to have our morning call meetings where everybody came in and then went out to their jobs out in the world, and now we do it remotely, and it's so we don't really contact each other. Everybody has their own trucks, so it's all very it's pretty good. We're most of our office folks are working from home. We've been keeping up our productivities just where it's always is, and which is quite good. So until we're really safe, we're going to keep doing that. So that's our plan. Reaching out. We're also working with the health department. Early on, back in the early months, we worked with a professor from U of M who was looking at how we can see where these the virus turns up in our sewage systems. So we did some testing around the systems and found that we detected it. So we are now working with the health department to set up a program where we're going to be having test sites around our cities that we operate and maintain. To test for COVID. So if we can get it before people even actually know they have it, because it's still coming out of them, we can actually maybe ahead of time get in front of some of these outbreaks. So we're looking at that as a possibility, and we're working with the health department on that program.
Okay, so that conversation is kind of fascinating, but scary to me in the same thought process is that you're saying that through the sewage system, so through someone's poo, you can maybe determine where the next outbreak is going to happen?
Right. So, when you go to the bathroom, whatever you're evacuating from your body, it carries the virus if you have the virus. So it gets in our sewer system. Nobody's really exposed to sewage within our systems other than the people who operate and maintain them. And we have these systems set up so we're very, very safe. But that's, that's how these kind of things, outbreaks can be looked at. So going forward, when we have these facilities in place, there'll be just a little testing units in our drains that we can tap into from our electronic, operations. We don't have to even be there. So we can take these samples and then send them in for processing, or even potentially process them on site once we get going with those kind of tests. So these are the kind of things that we can do. And going forward, when other outbreaks happen, and we're human beings, we're susceptible to viruses. As these things progress in our human history, these are the kind of things we can do to make sure that we catch them in time. Your previous guest, the doctor, was incredibly informative. I learned a lot from that, just hearing him. And I appreciate these kind of long form interviews because it allows people to really get more into depth than you get in the short things you get on regular TV. So I appreciate that.
Jim Nash with us. He's the Oakland County Water Resources Commissioner. And earlier on in the pandemic, we asked about this. And I just want to follow up again because like we said at the end of the previous interview with Dr. Vieder, things change over time. Some stay the same, but the context is always different as we get further into the pandemic. So your team has of course been working throughout this pandemic as is normal, as much as that is possible. And earlier on, we had in the pandemic, we had touched on some common issues we were seeing arising as people were at home more often and were using more of their in-home water resources and their drains and their sewer systems and so on. Are we seeing any common problems right now with people who are at home or are at work that are affecting our systems in the Oakland County area? And what are maybe some ways, if those problems are in place, that we can work to keep our water and sewer system as pristine and working properly as possible, especially during these times where it would require workers to be going out and about more often in order to fix them?
Oh, sure. You know, I mean, how people react to this has changed over the time. And initially, when everything was shut down, you know, there was we were doing only emergency work. So that was I guess, you know, 2 months or so, that we were stuck right doing that. And so, we had, some of our stuff, our folks that were our field folks were doing week on, week off. So we could do, just to keep people a little safer. So we're not exposing anybody as much. So over time that's changed. You know, wearing masks is very effective. Again, early on, we're in this process of doing our replacing lead lines. You know, I mean, this is the lead rule that came up a couple of years ago. We're actually, next year is when the real full force of the changes starts. We've been doing them this year, some, but again, this has held that back because we don't want to be in people's homes talking to them, you know, a significant amount of time with bringing in crews and stuff doing work in their homes. So, I mean, we held back on that. But going forward, we're going to be starting this up again as soon as we can. So we're looking forward to that. In terms of how people use their water, again, initially in that first shutdown, water usage dramatically dropped because industrial use of water is a significant amount of the water use in this country. And our industry shut down. So that dramatically dropped. People stayed at home, but you don't using industrial water at home. So while their home use rose, didn't rise nearly enough to make up for the industrial use. So industrial uses have come back some, and every month we've had more water use from the industrial side, and more people going back to work. And that's kind of relapsing, we're thinking, and we're not sure. Again, that's something that we have to look forward to. But it just depends on how much this hits again. If it gets extremely active and a lot of people are hit by it, I'm not sure what's going to happen. We might have to shut down again. I mean, we'll be prepared for that, but we hope it doesn't happen anytime soon. So again, as winter approaches, our immune systems are down. We're getting less sun. All the things that contribute to having more exposure to the virus, you know, starts that to happen. Canada I saw an article today that they had their Canadian Thanksgiving a couple of weeks ago, and now they've had a significant increase in the disease. So it's hard to say. I would still encourage people like the doctor did to stay home as much as you can. When you're out, protect yourself and protect others. You know, that's the whole thing. You're protecting everybody, yourself and others, by wearing masks, by being safe. So that's what we need to be doing, and my office is going to concentrate on that. We're always informing the folks at the latest thing, you know, how to take care of themselves at home too. So we keep in communication with our staff that way. So, I mean, going forward, this is going to be something that will change again, and we're hoping to make sure that we stay ahead of that.
And Jim, knowing that, Jim Nash with us here on the Oakland County Megacast, he is the Oakland County Water Resources Commissioner. Jim, as we're facing this second surge, at the end of the day, you and your staff, you are paid by the taxpayers. Do you think there is some benefit that could come out of this, such as remote working, that could save the taxpayers some money in office space, or any long-term talks or consideration that could go into this pandemic that could benefit the taxpayer?
Sure. Well, first of all, I don't run my office on taxes. I get about 1.5% of my budget from the county budget that's from taxes.
Right. Well, at the end of the day, though, the individual person pays your money. We pay you and your staff salary.
Right,
like,
through rates, through the rates for the water we charge. So
right. So the public
when that doesn't change, I'm sorry.
So the public pays for your salaries.
Exactly. So when we're doing this, everything we're doing is to try to bring as much efficiencies and to make sure we're operating at the maximum efficiency of our operations. So all of that is caught into what we do. You're right. We have a significant number of our office staff, our engineers, all the people that work in the office are working from home. We're actually this week we're doing a survey of all the folks to see how they like it, what can we do better, how going forward once this is over. How do you see that working? Can we do things like share offices where some people come in Monday, Wednesday, and Friday, some people come in Tuesday and Thursday? Those kind of things can be done in a way that benefits everybody, and we can use our facilities more efficiently. Our field crews still have to be out there. This is for the office folks. But so, yeah, there's a significant amount of that we're looking at to see how we can approach this in the future. I'm sure governments all over are doing that because, we've always had some folks that work this way. And a lot of my people, again, are out in the field. They're not necessarily doing, field work, but they're at projects overseeing it, as engineers and things like that. So, we're out in the world, but we try to make sure that it's always done safely and at the minimum we can. So, we do this like Zoom and things like that. And again, when we have meetings with communities, more people show up at these meetings because you don't have to drive to get there. You don't have to spend time in transit. You just shine on and shine off whenever you feel like doing that, and you can get more information. So it actually has been successful for us, and especially in community outreach. So I really appreciate that too. So again, going forward, we're going to have to change. I mean, everything changes. Our industries are changing. Our auto plants are changing. All the different things to react to this, and I think we can bring more efficiencies. Again, all this feeds into how the amount of less travel we're doing helps our climate. All the things that we do are to become more efficient. Also help with. We're using less fuels. We're using less fossil fuels. All the things that climate is changing, we can now use this to help change that.
There are a lot of positives coming out of this pandemic. You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. And knowing that, Jim, anything that we didn't touch on here today that you want to get out to the listeners and the viewers before we let you go?
We operate, I have 375 employees. We operate and maintain systems in every community in Oakland County. You probably have already seen my blue trucks around that says WRC on them. We depend on folks for things like telling us about people doing illegal dumping of, anything, pollutants, sewage, all kinds of things. We're always looking for the public to help us protect our environment. Oakland County depends on our water resources. We have more lakes than any other county in Michigan. Our property values, if you live anywhere near a lake, are much higher. If something happens to one of our lakes, an oil spill, some kind of fish kill, it affects property values. It affects every one of us, and we have to protect our water resources. We have people in Oakland County and Michigan, and I've lived all over the country, who more understand protecting water more than any place I've ever lived. And just people get it. When you say, look, we have to protect this, people understand we have to protect that. We're surrounded by 20% of the world's great fresh water. We have a moral responsibility to protect that. I work every day to do that. My staff does. And the people that I deal with in our communities and our leadership in state and regional levels are all on board for this. Our citizens are. We want to protect our water resources, and we're going to do that, and we get public support on that. I want to appreciate that the public does care about that.
Well, we appreciate having you on the show as well, and you touched on illegal dumping. Anyone who has ever watched any of my previous reports, you know how much I cannot stand illegal dumping. And so if you can't report it, or if you're not comfortable reporting it to the state or the city entities, by all means, get a license plate, report it to me. I will track them down and I will return it to them. Return of senders, but we like to call those, because there's nothing worse than trying to pollute our communities with someone else's dump. And quickly, before we let you go, do you have an illegal dumping hotline?
Absolutely. You can go to, you can call 248-858-0958. and tell them that you're reporting that, and they'll send you the right person. Or you can go to my website, oakgov.com/water, and just put in the top search reporting pollution, and you'll get the number of the office right away. We enforce it and we clean it up.
Well, that's awesome. Thank you so much, Jim Nash, for being with us here on the Oakland County Megacast. He is the Oakland County Water Resource Commissioner. Tyler, I was talking to someone in the city of Detroit not long ago, and they were saying that since I left Channel 7, one of my big crusades, I was an advocate reporter, was illegal dumping.
Yeah.
It drives me crazy. People do not understand the level of illegal dumping and what it does to a neighborhood and a community. And since I left Channel 7, they were saying that their calls and their reports to the tip line and to the email, they were down like 75%. But I may not be at Channel 7 anymore, but trust me, I still have resources, and I will still track you down, and I will still shame you. So anyone who knows that,
She'll do it too.
don't hesitate to contact me, because that drives me crazy, because it impacts all of our communities. And so many times it is the contractors or business people that are doing it to try to take a shortcut. And it's not just our environment that suffers, it's our entire neighborhoods. So do the right thing, especially during this pandemic. Hey, we're running a little bit behind, but when we come back, we are going to be joined by Ben Winger. I love his name, by the way, because he's the assistant professor and curator of birds, Museum of Zoology, and the Department of Ecology and Evolutionary Biology at the University of Michigan. Get his name? Winger. Do you think that was like
fantastic? It's a natural fit.
It totally is. We'll be right back on the Oakland County Megacast.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Have you with us here on the Oakland County Megacast, the Thursday edition. I'm Ronnie Dahl, here in the studios with the one and the only Mr. Tyler Keefe. Always great to have you with us here on the Oakland County Megacast. Just a reminder, you can catch us Monday through Friday, 10 a.m. to noon, Civic Center TV, Birmingham area municipal access. Catch us on Channel 15 if you have Comcast, Channel 99. AT&T, if you're out driving around, 89.3 Lakes FM, 88.1 FM The Biff. We also want to say a huge thank you today to the West Bloomfield School District for allowing us to live stream today's edition of the Oakland County Megacast on their Facebook page. So we appreciate that. You know, I had contractors in my house yesterday, and one guy's like, because I was like running up going, trying to, but they're hammering and this, that, and the other. And I said, I'll be off the air. And they're like, what do you do? The guy's like, I'm in Macomb County. Can I watch you? I'm like, you can watch us from anywhere.
Can.
I think most of our viewers and our listeners are actually through social media. Today's day and age, that's where we get our news, and that's where we watch our news as well. So many of us don't actually tune in to TV that much unless it's like Netflix or on demand. That's what I do, a lot of things. So just a reminder, you can pretty much catch us everywhere. So while we like to focus on Oakland County, we definitely expand the entire state of Michigan. In fact, our next guest comes to us from the University of Michigan, Ben Winger. He is a Ph.D., the assistant professor and curator of birds, Museum of Zoology, and Department of Ecology and Evolutionary Biology. They're at the great school. I'm saying that because Tyler is a Spartan. At the great school.
Let's cover this up right here.
The University of Michigan. Wolverine, blah, 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 blah.
There you go.
Yeah. That's where my niece goes, though. She is U of M all the way through. Go ahead and, Professor, tell us why you guys are so much better than the Spartans.
Thanks for having me. I think I'll let the Spartans ponder that one, but happy to be here.
So can you give us an analogy? It's great to have you with us because we have an important conversation, but I have to say, when you're looking at your name, how did you get fascinated with birds and your last name has a wing in it? That to me is serendipity.
Yeah, that's been brought to my attention. I guess I could have been a pilot or an ornithologist, but I chose ornithology. I've always been interested in nature since I was a young kid, and became interested in birds in middle school, and just kind of never stopped, and have managed to make a career out of learning about and teaching about birds.
But I love that, as well as your curiosity, because it kind of piggybacks on your name. But on top of that, right now, we're in the middle of a pandemic. The one thing we've noticed, so many people are getting back to nature. And do you think that's going to help foster the love and bird watching? Because every morning, my husband, I live on the West Bloomfield Trail, and my husband and I talk about all the birds that are coming to visit. It's a cardinal, or it's a blue jay, or, cardinals we always look at as a message from heaven. But it's beautiful that we're getting back to a sense of nature. So do you think in a way this is going to be a positive coming out of this pandemic?
Well, I think it's great with anytime anyone notices wildlife around them and notices birds, and obviously the circumstances are difficult, but if people are taking the opportunity to slow down and look at and listen to what's around them, I think that's great. And usually with bird watching, it's just a matter of exposure. So once people learn a few birds or become more aware of birds than they were before, it usually sticks, and it's something that carries through. So at the beginning of the pandemic, we were also seeing more consequences of quiet streets and less traffic and things like that, which was giving people a new awareness of birdsong. I think probably that has, tailed off a bit as some of our activities are, back on the road. But certainly I've been hearing a lot about people getting interested in birds and birding for the first time, which is great.
So I just saw someone post on my Facebook page. They are, I believe, on the east side of Detroit, and they're seeing a crazy number of wild turkeys return to their neighborhood. What's behind that?
Yeah, turkeys have been in parts of Detroit for a while now. I don't know the whole details of that story, but I've certainly seen wild turkeys throughout parts of Detroit, and part of it is in certain areas, if there's brush or empty lots or things like that, they will be able to take advantage of that and find enough food. And certain animals are just able to adapt more to kind of an urban or semi-urban landscape than others.
We've had a lot of parents now going out with their kids to explore nature because they're home with them more. In some regards, it's even part of their school lesson. How would you, or what would you say to parents who have a kid that maybe have a little bit of interest? How can they continue that interest? Are there any apps that are out there now or new technology to help keep that spirit alive or to help keep fostering that interest?
Yeah, that's a great question. I mean, I think with kids, I think kids are naturally interested in the natural world and the outdoors. And so I think one of the main things parents can do is to follow their kids and let their kids show them what's interesting. And it can be small, particularly with young kids. It doesn't have to be seeing a particularly rare or special bird. It could just be whatever, insects or nature or animal tracks are right there nearby. And I think it's, on the one hand, it's also an opportunity to unplug and get away from apps. But at the same time, there are some great apps to, help foster that interest and keep it going. And so there's a number of field guides for birds where you can look up what kind of bird you're seeing. The Cornell Lab of Ornithology has a app called Merlin, which will actually help you identify birds you're seeing based on their characteristics. And that has increased in popularity a lot lately and can be very useful for a lot of the birds that we see in backyards and suburbs.
Ben Winger with us, assistant professor and curator of birds at the Museum of Zoology and the Department of Ecology and Evolutionary Biology at the University of Michigan, with us today on the Oakland County Megacast. Dr. Winger, you recently were interviewed in an article with MLive about some unusual birds that are showing up around the state of Michigan. One particular that was spoken about was the Winter Finch, which is experiencing a bit of an invasion through Michigan. Why are we seeing some of these more unusual birds more often now than maybe we had previously? Is it because we're much quieter than we normally are due to the pandemic, or are there other circumstances, maybe weather related or others, that are attracting more of these kinds of birds to come out of the woodwork or to just come to Michigan at this point in time?
Yeah, so what we're seeing now is what scientists call an eruption or an invasion of some more unusual birds, finches, and so we call them winter finches, and there are a number of different species. And what's going on here is that these are birds that they breed and live most of the time in really northern areas. So northern Michigan, the Upper Peninsula, that kind of northern forest, and then all throughout Canada as well. And they depend on the seeds of various trees. So some of them are really tied to pine trees. They can only eat the seeds of certain kinds of pines. Others mainly eat the seeds of birches and other northern trees. And every so often, every few years, these trees don't produce as many seeds. And so the birds don't have as much food to survive that really cold northern winter, and they start to move south. And those movements can be really unpredictable and kind of erratic. So whereas a lot of, when we think of birds migrating, like Canada geese migrating overhead, they go south for the winter and come back north in the spring. And it's very regular and predictable in a lot of ways. With these birds, they don't do these movements every year. And so what we're seeing in Michigan now is kind of once every several year invasion of these birds from these northern forests. And part of the reason it's very noticeable is that these are also birds that come to feeders. And so backyard bird feeders will attract some of these northern finches. And so people can see them really up close in their yards.
I was just going to say that when it comes to our feeders in our backyard, for the individuals and the people out there that love to start their morning, maybe drinking their coffee, looking out their window and seeing the birds out there in the morning, is there something, a specific food that you can maybe put out for them to keep them around through these long winter months that also maybe the squirrels don't like so much as well, because sometimes we don't like to share.
Right. So the two kinds of bird feed that are the best for birds are going to be black oil sunflower, or really any kind of sunflower for some of the larger finches. And then the smaller birds like goldfinches and some of the other small finches like siskins, which are around now, these will go more for thistle seeds, which are much smaller. And with those two, you can kind of you can cover the spectrum really. And those sometimes people buy a blend of birdseed that has things like millet and other kinds of seeds in it. And that's fine, but it's not quite as nutritious for the birds. It is less expensive though. So that's one of the reasons that people sometimes don't feed pure sunflower, is that's just more expensive. As far as squirrels go, they love all that too. They'll take advantage of it. And so to keep squirrels away from your feeder, you really have to, it's really more of a physical arrangement of the feeders, or buying or making some sort of baffle or contraption that keeps them from being able to climb poles. Of course, squirrels are very clever, so sometimes they can outsmart you, but I think you just kind of have to enjoy the process of constantly trying to keep the squirrels away. And sometimes what they do to get at the feeders can be pretty entertaining in and of itself.
And we've definitely been watching them this year. It seems like in our backyard along the West Bloomfield Trail, we've had an abundance of squirrels, especially black squirrels, eating all of our birdseed as well as all of our pumpkins and all of our gourds and everything else. I've taken to shooting them with the squirt gun. I don't know if it's so successful, but it's humane because I hardly ever actually hit them. So I have a terrible aim. And knowing that, Ben, quickly before we let you go, though, for the people who enjoy this and love to see the birds come to their backyard each and every day, because a lot of people do look at them in symbolic ways. It's not just a bird coming to their backyard. They do see there's a symbolism to the birds visiting their backyard and the beauty of nature as well. What do you think the long-term impact of this pandemic could have on birds in general here in the state of Michigan?
Well, in order to achieve bird conservation and all wildlife conservation, we need to be invested in it, and we need to know something about it. So the more people that are exposed to birds and nature, the more success we'll have in being able to conserve it. And so I would encourage anyone who has just for the first time taken up an interest in birds during the pandemic to look up ways to continue this in the coming years. So there are local Audubon societies or national organizations that foster the interest in conservation of birds. And so there are so many ways to get involved. Birding is also a really social activity at most times. And so hopefully when we're able to be together in groups again safely, though, new birders can join up with birding clubs and go on walks and learn from experts.
Yeah, and that might be the beautiful thing that comes out of this COVID-19 crisis. People have realized the beauty in their backyards in birds, and it has sparked an interest, and they keep that interest going by joining some of these groups, even if they're virtual right now. Like you said, they're social, and then maybe you can join the groups at another time post-pandemic. But it's been great having you with us here. Ben Winger, he is the Ph.D. Assistant Professor and Curator of Birds for the Museum of Zoology and Department of Ecology and Evolutionary Biology at the University of Michigan. I have to tell you, Ben, I'm a former producer of local TV news from back in the day, and I look at your long title, and it would have me scratching my head how I would fit all of that in what we would call a super, which is your name title, because usually you're very limited. But it's been great having you with us. We so appreciate it. I'm coming up with all these bird jokes right now, but I won't share them with you because I'm sure they're just too foul.
Right. There you go.
Just wing it.
You've heard them all, right? Tyler said just wing it.
Exactly. Well, thank you for having me.
Hey, good luck. I'm sure you hear them at Thanksgiving with your family as well.
Oh, yeah.
But it's great having you with us here on the Oakland County Megacast.
Those jokes this won't fly here.
Oh, gosh.
Hey, don't get me started. And
this is what Sunday dinner at our house is like. We sit here and we come up with these one-liners back and forth all the time. So those were some good ones. Tyler, I'll give you a full point.
1 point, that's all I need.
For those. But you know what, though? The beautiful thing about this pandemic and this crisis is our return to nature.
Yes.
And so many people taking notice of our nature and the beautiful gifts that we have in our own backyard. I always say that my backyard and the West Bloomfield Trail is nature's playground. And I'm extremely grateful each and every day to have that playground in my backyard. Although right now the squirrels and the deer are eating all my pumpkins and my birdseed, not so happy with them.
No.
But with that, we're going to take a quick break here on the Oakland County Megacast. Still a lot to get to in the last half hour.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Great to have you with us on the Thursday edition of the Oakland County Megacast. Still, you know, we are so lucky the weather has been incredible this fall. And even though we're on the downswing right now, we're seeing a bit of a cool spell. Still nowhere where we were last year. Right now, this time last year, we were buried under 8 to 10 inches of snow. That is not the case right now, and I can tell you a lot of restaurants really appreciating this beautiful weather that we have had this last few weeks and this last month or so, because boy, it's going to be tough for them going ahead in the next few months. And to talk a little bit more about our restaurant industry, which is really the backbone of our economy here in the state of Michigan, let's bring in Melody Baton. She's the restaurant critic and reporter for the Detroit News. Great to have you with us again here on the Oakland County Megacast.
Thanks for having me.
So I know that we've had you on the show before, and at that time we were kind of in the summer months. Things are switching right now. We can just start off with the latest update from the health department. What went from a mandate to now a strong suggestion that they track the customers that enter their establishments for contact tracing if needed. How is that going with some of the restaurant owners that you've been speaking with?
Well, I've seen a variety of different ways they're handling it, from a sign-up sheet at the front door, which is actually not advised just for privacy issues, but it's kind of a way to get it out of the way, kind of leave it up to the customer to put down their correct information. And then there's restaurants that have reservation system anyway that gets your name and phone number that way, and always has, and it's not really an issue for them. And there's also some places that, you know, like think of neighborhood dive bars that they kind of already know everyone and how to get a hold of them. So, you know, especially the regulars and people that come by. if you pay with a credit card, they have your name. And I've also seen places kind of have fun with it. And, they'll ask for your name and number and then put the diner in a raffle. And maybe at the end of the week or the end of the month, they'll pull out a couple names and give out some gift cards or free dinner or something like that, which is kind of incentive to give your real information and just be nice about it instead of, saying, I don't want to give my information or giving a fake name, because this is really all for a reason, and it's for your safety. I saw a lot of people on social media say, well, I'll just give a fake name or whatever, but it's like, but what if there's an outbreak, and wouldn't you want to know? So it's really something that I think that if you want to participate, people are, and the restaurants are just doing their best. But I think that the relaxed, like you said, the going from a mandate to a guideline was helpful for the restaurants and the employees of the restaurants, because on top of that, they still have to police masking and social distancing. So they've got more tasks to do in their mind and in their work every day, on top of being short-staffed and not having as many customers.
I will say, because I've been to some restaurants since this started, and I will say the restaurants that just leave the book open for you to sign, some of the things that people come up with, obviously not their real name and number, are hilarious. I know that that's not the intention and the purpose, but at the end of the day, too, I will say it's not good to leave public information out there, because I know at one time in my life I had a stalker, and it's not a fun thing to go through. And if you have someone come behind you and you're having to leave your name and number, and it's out there for the public to view, that individual now has that number as well. And when you have a stalker, it can be a real situation and a very scary situation to go through. But at the end of the day, too, it can't be put on the restaurants to know that and have to try to mandate that as well. So there are so many different facets to this. You just knowing what you're out there in the restaurant world, do you anticipate another shutdown is coming? Because Ohio's Governor DeWine pretty much put out the threat yesterday, saying that a shutdown is probably coming for the restaurants and the bars as well as the gyms in the state of Ohio, which was so much more relaxed months before the state of Michigan. Do you think Michigan is going to be following suit? And if that's the case, are these restaurants really going to survive another shutdown?
I think it's absolutely a possibility that Michigan could shut down its bars and restaurants again. I wouldn't be surprised if it happened. I don't know. I think, it's obviously up to the governor. It's up to the government to do this and how they do it. With the last shutdown, what the Michigan Supreme Court said was unconstitutional. So that was kind of that issue. So I don't know if they're trying to get the legal ducks in order to make it stick, or if that's something the health department can put the hammer down on. But I would not be surprised at all. I think that they're trying to avoid it just because it is going to be terrible for especially bars. Restaurants, they can do carry out. We've got a big carry out day coming up with Thanksgiving. But places that just sell drinks that are small, you can't really do drinks to go and make a dent in the bills. I think it's going to hurt a lot of places, and unless there's some kind of stimulus or relief for them, I think we're going to see a lot of places close at the end of the year. If things shut down, especially with, like you said, the colder weather coming. So I think a lot of people are going to feel less comfortable going out as well, because they won't be able to have that patio to sit on, and things like that.
It's a tough time to be a restaurant owner or a bar owner here, not just in the state of Michigan, but really anywhere in the country. And knowing that, because you're out and about so much more than the regular individual. I think about the smaller entities, because I've gone into a lot of bars and restaurants, and it's really been, for the most part, business as usual. You almost wouldn't know, other than the headlines stating that these rules and regulations have been put in place. A lot of places, it's really kind of business as usual. And the ones that aren't, who are being really strict, I see people turning away and walking away because people are going to a restaurant or a bar to escape reality, not to be slapped in the face by that reality. And so it's so tough for these restaurant owners and these bar owners who are put in these places. What's the difference you're seeing in maybe a big city like Detroit versus the suburbs?
Well, I think in the suburbs, I'm seeing a lot more big tent setup, where there might not be as much room for that in the city. I think that I was, it was Greektown a couple of weeks ago, and they still had outdoor dining set up, even though it was into the fall. But in the suburbs, I'm seeing a lot of tents taking over the entire parking lot. And this isn't just for outdoor dining. The tents, even though they're enclosed, or the domes that you see, even though they're enclosed, they do offer some kind of, cross breeze, and they can be, sanitized. But they're really for capacity, I think, more than just people feel more comfortable eating outside. I think the restaurants are trying to increase their capacity by doing these outdoor tents. And I'm seeing a lot more of that in Macomb County, and it's all over Birmingham and places like that versus the city, where I think in the city you've got a lot of, special occasion restaurants, destinations where people from not just Detroit but all over come, and they want to make it a big night out. And they're really, they want, like you said, they want it to feel normal, and they want that experience. Because, every once in a while you've got to do something that, makes you feel like everything is okay and everything's normal, even though it's totally not. And I think the restaurants are trying to convey that, hey, you can come in, relax, have a nice meal, have service, and we'll keep you safe as possible.
I will say I love the domes. I think they're adorable. It's such a cute atmosphere and what they're coming up with. Now we're seeing the city of Northville and the Downtown Development Authority working with some of the business owners there, coming up with basically kind of these hut type situations to put throughout the city of the downtown area to entice people to continue to come out in the colder weather months. And I think that's okay in the beginning, right? And in January, even December, January, where it's still 20s and the snow is falling, it's cute. It's quaint. Yeah. But when it gets sub-zero temperatures, no one's coming out. It's no longer cute. It's no longer quaint. And knowing that, do you see any of these restaurants maybe saying, we can't get employees, this is too costly? Because we have to remember that they're investing in these entities. They're having to pay for the tent rental if they can find them. They're having to pay for the heater rental if they can find them. But so this is an additional expense to a restaurant that's not making money that it once was. Are there some that are going to be, we're just going to close down until springtime maybe?
Yeah, I wouldn't be surprised if we saw some restaurants kind of hit pause. I know I saw just the other day a really cool tiki bar on the east side of Detroit. They just said, you know what, we're going to take a break because they're a tiny bar, and that's the whole experience is you're kind of tucked into this cool tiki bar, and they they're not going to be open because it's just not worth it for them to staff it to literally have probably 6 people in there, maybe a little bit more than that. So they're saying, we're not closing down, but we're not going to be open until till basically this clears up and capacity is back at it. I think we're going to see a lot more of this. Every single restaurant owner and every single chef I have talked to in the last 3 months or more has mentioned that they are hiring and they need help, and it's hard to find. And you have to consider that when you go out to eat, and the service might not be what you expect or what it was last time. These restaurants are really doing their best. People, there's the people that are afraid to work. There's the people that can't come back to work. And the people that are working with added responsibility and with less colleagues to help them.
Melody Baton's with us. She's a restaurant critic and reporter at the Detroit News, joining us on the Oakland County Megacast. And Melody, earlier on in the interview, you mentioned that Thanksgiving is a big to-go day for restaurants in our local area for those that are preparing for the holiday but maybe aren't going to have their family in or go to see family because of the ongoing pandemic and the current circumstances in the state of Michigan and the U.S. in terms of COVID-19 cases. What are some places in the local area that they should be on the lookout for as potential to-go options so that they can celebrate the festivities at home with themselves and those they cohabitate with, but also support some of our local businesses as we're going into this time that may be very difficult for them.
Yeah, there's a lot this year. I usually do a list of some of the bigger packages. We can get all the fixing in one fell swoop with the bird and everything. But this year, it's a huge list. I'm seeing restaurants that never offered Thanksgiving to go getting in the game. I'm seeing like the Royal Oak Farmers Market has a cluster of caterers that they've gathered. So you can order online from a little bit from each of them and then get picked up all in one spot. This is kind of the big day for restaurants that haven't had a big day in a while because of the pandemic. I think you're right. Like you said, people are the groups are going to be smaller, and maybe the person that usually makes the turkey isn't going to be in your group this year, or maybe the person that makes that sweet potato pie isn't going to be around. So more people might be looking to carry out because they're not the ones that cook normally, or maybe they're tired of cooking because I know we've been a lot of people in their own kitchens throughout this, the shelter in place and stay at home. So there's a lot of options. Basically, what I would recommend to people is think of your favorite restaurant and check with them first. You might be surprised to find they're offering Thanksgiving to go. I'm seeing a lot of vegan options this year more than last year. Chive Kitchen in Farmington Hills is doing, they're a caterer. They're doing the pickup vegan meal with dessert and everything. Cooking with Q in New Center has, what is she doing? She's got a mushroom gravy that sounds really good. And she's doing kind of a, plant-based vegan meal. So it's not just birds, but I'm seeing a lot of places doing turkey and doing smaller versions of the turkey where you can get just the turkey breast with gravy or just the, pieces of the bird rather than the whole thing with all the fixings ready to go. So I'm seeing smaller packages and a lot of different, a la carte options. A lot of restaurants are participating. I was surprised this year, but it makes sense.
You seem like you have such a fun job, though, getting to get out and taste all of these restaurants and their fairs. And with that, Thanksgiving, the night before Thanksgiving, or Thanksgiving night, I forget, it's been a while, for me, typically a huge bar night. I think it's actually Thanksgiving night. Is that going to change this year? Because a lot of the college kids come home, they, especially the freshmen, they get to visit with their friends that maybe went off to different colleges. Is that going to still be an event this year for restaurants and bars?
I don't think so. The night before Thanksgiving is typically used to be called the biggest bar night of the year because, like you said, the kids come home from college. Everyone's in their hometown for Thanksgiving, so they get together. But obviously, there's not a lot of places open. There's not a lot of nightclubs open, which is this is a big night for dance clubs and nightclubs, live music venues, things like that. So that's not happening. Plus, we're not gathering. And plus, I think that really in the last couple of years, I've seen Halloween surpass the night before Thanksgiving as a big bar night. So I don't know that the younger generation really gathers before Thanksgiving. I mean, there's always events, but I think definitely this year it's just a fraction of what we would normally see.
It's definitely going to be a different year for Thanksgiving for so many of us and the restaurants as well. Melody, thanks so much for being with us. She is the restaurant critic and reporter for the Detroit News. Always great having you here with us on the Oakland County Megacast. And this continues to change, the COVID-19 crisis, and boy, the restaurants really feeling the brunt of this pandemic, and we're hoping more of them survive, but we are seeing more and more close, but we're hoping that they do hang on during these rough winter months ahead. So thank you for being with us.
Thanks for having me.
Tyler and I are going to take a quick break here on the Oakland County Megacast. Just a few minutes left in the show, and we're going to round it out by speaking with the principal over at the West Bloomfield High School. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services. Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Great to have you with us on the Thursday edition of the Oakland County Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keith. Just a reminder, you can catch us right here Monday through Friday, 10 a.m. to noon. Civic Center TV, Birmingham area municipal access, Channel 15 on Comcast, Channel 99 if you have AT&T. And then also if you're out driving around, tune us into the radio, 89.3 Lakes FM, 88.1 FM The Biff. We also want to say thank you today to the West Bloomfield School District for allowing us to live stream today's edition of the Oakland County Megacast on their Facebook site of the day. So we want to say thank you. And with that, let's go ahead and end the show by bringing in Eric Pace. He is the principal of the West Bloomfield High School. And as we were speaking earlier, Tyler, sometimes we have some of these guests on, but boy, everything changes so quickly. Yeah. And so, Principal, the last time we had you on, I think we were all excited about having the students back in the classroom. And now things have changed yet again. How are you and your team holding up with the latest surge in coronavirus cases?
Yeah, thanks for having me. And I appreciate the question. So how we're holding up is okay. It's okay. We are, it's a little easier when you're committed to a common passion, which is to educate kids. So whether they're in front of you or remote or somewhere in between, right? The work is still there and it still remains the same. And then we have people that are extremely passionate about it. So we're holding up okay because we know we have a real defined purpose and an importance right now.
And we talk about that, and I know that you and your team behind the scenes are working around the clock. This is not easy. Like, typically we like to put a plan in place. This is our plan, and we're going to follow it. But your plan has to look like this crazy flow chart, right? Like, so many different avenues and streams coming off of that flow chart because COVID-19 is not following any path that we can anticipate or even want to follow. And so you're having to make adjustments on the fly. But unfortunately, when you're making those adjustments, they directly impact hundreds of families. So I know that you can't make everyone happy, but knowing that, what has your message been to the parents and the students right now?
Yeah, our plan is no different than it was, when I started in March or when I started in education 15 years ago, and that's to educate kids, right, to be the best they can in and for the world. Now, the way we do that, that plan changes, feels like hourly. Our goal is to get kids in person with our teachers face-to-face as soon as possible, but to do so in a safe manner. So I just left a meeting where there's 3 new plans to branch off of our current plans that look at ways that we can try and accommodate that safely depending on what this virus does and what our numbers around us do. So, the easiest way to look at this is that, we want to be back in class. Our teachers want students back in class, but we need to be safe about it. And we need to respect, our teachers and what they do, as well as what our families' preferences are. Hope isn't a plan. Okay, hope is what we all have right now. But if we rely on that, then we're going to kind of just flail in the wind. So we really are working behind the scenes, like you said, to just examine and re-examine all the different ways we can possibly be successful at this remotely, as well as getting students back as soon as possible.
One other thing I would think that makes your job so difficult is you're not just targeting one simple demographic. You have so many different demographics, and by demographics I mean you're looking at kindergartners and special ed and junior high and high school. There's so many different elements to this plan that you're trying to put in place, and knowing that do you wish that you would have just stayed all remote this semester to eliminate some of this confusion, or have those months and those weeks of being in class for some of the students been extremely beneficial?
I think in West Bloomfield, we've been pretty forward thinking and intentional about how we target each group. I'm actually, interviewing with you right now from my wife's first grade remote classroom, if you can't tell, with the background. So our kindergartners through 8th graders have been in person on an AM/PM rotation. Our high schoolers have been completely virtual because of the sheer number of students and the mixing that they have between classes. And then our students with needs that are identified through an IEP and special education, some of them have been in person at the high school. So we've really tried to differentiate those plans to meet those groups' needs individually, and we're really successful at it. It took until just 2 weeks ago till we had our first positive case anywhere, and all of the cases that we had that led to quarantines all came from outside of the school district, within the families and the community. So I think by targeting individual demographics in unique ways, we were really able to meet the needs of those students and those teachers. Now, we can't control what goes on outside in the community, and right now that's dictating some of what we do, but we are planning behind the scenes feverishly to try and work around that and be able to come back safely as soon as possible.
Eric Pace with us here on the Oakland County Megacast. He's the principal at West Bloomfield High School. And I love what you were saying. It's like you're trying to control what's happening once they enter that school door, but you can't control the attitudes and the behaviors outside, but yet it's having a direct impact on you. And knowing that, when do you think that long term it's not going to be until a vaccine is widely distributed until we can get back to some sort of normal when it comes to teaching?
I don't think normal as we knew it a year ago is ever going to be the same, because I think we've learned a lot in how we deliver education and what remote instruction looks like, that we can really blend in some new tools and techniques and strategies. When it comes to being related to COVID and the vaccine, again, we can hope all we want. I don't believe that's going to be a plan for us, right? So our goal is going to be to find ways to best meet the needs of our students. Some of that's going to be in person, some of that remote, as soon as it's safe in the community. We're going to reevaluate this here around Thanksgiving time, and then I think they're going to continue to reevaluate regularly in order to best determine how to meet those needs at each demographic level that you're describing.
Eric Pace with us, principal at West Bloomfield High School, joining us on the Oakland County Megacast. And Eric, we recently spoke to Deanna Barish when the decision was made to return the entire school district back to virtual learning due to the increase in COVID-19 cases. And she had mentioned then that particularly for winter sports, that they may be affected by this recent uptick, and that's going to depend somewhat on the MHSAA. Within the school district, as the MHSAA has urged before, all these decisions of whether or not to participate or when to bow out will be made at the district level or at the school-to-school level. Any talks in the district about what to do going forward with the current fall sports and with winter sports coming up and spring sports coming up as it relates to the COVID-19 pandemic, with school being virtual but these sports still, of course, being in person?
Yeah, that's a great question. So what makes our athletics and our activities unique is that they're already cohorted in small groups, right? So if I take, for example, a basketball team that might have 15 players on it, or even 3 levels of basketball, so it'd be 45 players in 3 different cohorts. That's the only group that they're mixing with. And what they do outside in the community, again, is outside of our control. I know our coaches really urge safety and responsibility, and we've done a really nice job with that. So if I, was looking at an entire school that was 15 or even 45 students with an adult per every 15 kids, I think we could be in school safely in person on a daily basis, right? So it's all about how you limit that cross contact and exposure between groups. So even something as large as a football team, which some football teams, including ours, are still playing in the playoffs right now, it may be 60 students with 5, 6, 7 adults. And so when they run their practices and their drills, they can really distance themselves and work in small pockets in a way that would, if there was any positive cases or anything like that, would really limit exposure and not have to shut down per the CDC and health department recommendations. So when it comes to winter sports, they're all indoors, which can kind of throw a little bit of a challenge into that, just based on what the recommendations are health-wise. But our goal is to continue to offer these activities and these opportunities for students as best as possible. But there are talks, of course, and there are frequently about how to do those things safely. Is it worth looking at pausing things for 2 weeks? Is it, no spectators? So no plans have been finalized by any means. And we're definitely going to work really closely with the MHSAA and our Oakland County Health Department on that.
For me, we're going back a while here, but for me, what made school so special wasn't so much about going to class each and every day. It was those other activities, cheerleading, basketball, track, student council. That was the important, not the important part, because we're there for an education, but those other activities do mean something when you're doing college applications, but also for some students, that's what motivates them to actually go to class and to excel, is to be a part of those extra groups and extra activities that schools typically offer. And now that you're having to go online, are you worried that some parents are going to say, online teaching's the way to go, and you're going to lose students? Because at the end of the day, this is a numbers game, and your budget is based on how many students you have in the seats. Are you worried that you're going to lose some students permanently because you're unable to really offer those in the same spirit of what they were offered, pre-pandemic?
Yeah, I think that's a great question. Again, we'd be lying to ourselves if we say that education is in a competitive marketplace where families really do have a lot of options on how to best meet the educational needs of their children. So what we're looking at is, how do we learn from what's gone on since March, right? How do we take the things that we've already been successful at and then build upon that and expand to provide diverse options for students? Is there a way that when we return face-to-face that we can flex some of those classes to be remote or just remote at times? Is there a way to flex the time that you do come to school and don't come to school? And then also blend that with, like you said, the culture, spirit, and community of a high school campus. We surveyed our families to find out what it is that they need from us. What is it that they want when they come back face to face? And overwhelmingly, over 87% of them said it's the social interactions between their peers and their teachers. So we know that the need is out there and the desire is there. So in terms of the culture and what they're coming back to, we're confident that that's something we can provide. But I think we need to layer in these new modes of teaching and learning to really individualize instruction for our students.
So just another minute or so left with you here. Eric Pace with us on the Oakland County Megacast. He's the principal at the West Bloomfield High School. What has been the benefit and the silver lining that has come out of this, other than kids are no longer going to have snow days?
Yeah, that's devastating to me. But it's, for me, and I take this back to a quote from a long time ago, Winston Churchill, right? You never waste a crisis. So we have an uncontrollable situation upon us, and we can obviously dwell on that and what can't be and the things that we're missing. And it's important to grieve some of those things, right? But then we need to take a look at what we can learn, right? That's what we're here for, is to be educators, and those of us that are educators, and I think most of us out there are lifelong learners, right? If I'm 37 years old and if I think I'm done learning, then I should probably quit now. So we need to take a real hard look at how our students interacting with content and their teachers, how it is that our teachers are delivering lessons. I've never seen teachers work harder than I have right now. And I think that from that, we're really going to gain some positives in how to reach students in different ways, improve our efficiency, and a real appreciation for the work that we do in a classroom.
I can tell you, I do truly believe after all of this, you have a lot of parents that are appreciating teachers so much more. Just in like 10, 15 seconds, what have you heard from feedback from some of the parents out there?
The feedback's mixed as it always is, right? A lot of people want a lot of different things, but I think the overall theme is appreciation. People know how important this job is and what it means to educate kids, and we appreciate our families for being patient and being supportive as well.
Well, you're lucky I'm only a pet parent, because I would lead the revolt to bring back cursive writing and long division. No new math. You're like, okay, I'm done. Great to have you with us here on the Oakland County Megacast. We so appreciate your time, but also all the hard work. This is not an easy time for all of you over at the West Bloomfield High School, so thank you for all that you're doing. That's going to wrap it up for the Thursday edition of the Oakland County Megacast.